So question is, which of the following statements are correct regarding peripartum cardiomyopathy? So correct statement regarding peripartum cardiomyopathy. So as the name indicates, it is around the parturition. Peri means around and partum means birth of the child, or there is parturition. Parturition. So it is around the delivery. So it is seen within from 1 month or the last month, from last month of pregnancy to 5 months postpartum. So after delivery till 5 months she can present to you with peripartum cardiomyopathy. So first option, it is usually seen in the multiparous woman. So this is correct. The profile of generally these females, that they are multiparous plus they are young. So these are young females from 20 to 35 years of age. So this is the heart failure which is seen in the young woman. Number 2, echocardiography shows ejection fraction less than 45%. Yes, this is correct. EF is less than 45%, and this is one of the diagnostic criteria as well. One of the diagnostic criteria. Third option is that ACE inhibitors are contraindicated. No, this cannot be a generalized statement. ACE inhibitors are contraindicated only during pregnancy. But once there is postpartum, that is the delivery has taken place, there is no fetus inside the mother, you can very well use the ACE inhibitors. So ACE inhibitors are used in the peripartum cardiomyopathy. So third option is wrong. Fourth is history of prior heart disease is mostly present. No, this is one of the diagnostic criteria, that there should not be any history of prior heart disease. So it's one of the diagnostic criteria. So the option 1 and 2 are correct. So A will be the correct option. So reading more about the peripartum cardiomyopathy, that is, what are the diagnostic criteria? So it should fulfill these 4 criteria. The first one is that the cardiac failure, that the heart failure is from last month of pregnancy, to 5 months postpartum. Number 1. Number 2, it's a diagnosis of exclusion. You cannot determine. So there's no determinable cause of failure. You have tried everything to find the cause, but you have not found any cause. So there's no determinable cause for failure. So it's a diagnosis of exclusion. Number 3, which was also an option, there should be absence of previous heart disease. So there should not be any heart disease. So there should be absence of previous heart disease. And number 4 diagnostic criteria, that there should be left ventricular dysfunction on evidenced on echocardiography. So you send the patient for echocardiography, and it should give you evidence of echocardiography. It should give you evidence of LV dysfunction. What are the 2 evidences of LV dysfunction echocardiography? That ejection fraction should be less than 45%, and with it there should be left ventricular and diastolic volume and diastolic dimension should be more than 2.7 centimeter per meter square. So these are the 4 diagnostic criteria. The heart failure should be from last month of pregnancy to 5 months postpartum. So this is not seen in the early month of pregnancy. Second is the diagnosis of exclusion, that there should be no determinable cause for the failure. Number 3, there is absence of previous heart disease. And number 4 is left ventricular dysfunction evidenced on echocardiography, that is ejection fraction less than 45% or left ventricular and diastolic dimension more than 2.7 per meter square. Now, how the patient will present to you. So history. So it should be generally a multiparous woman. So it will be generally a multiparous woman. Number 2, she is a very young female presenting with a heart failure at 20 to 35 years. She will be complaining you about the weakness, shortness of breath, cough, paroxysmal nocturnal dyspnea, and palpitations. So she can present with any of these. When you go for examination, You can see that there is tachycardia. You can see there is peripheral edema, and there is pulmonary reels. You can go for ECG, which shows you arrhythmia. Then the treatment is you ask the patient for bed rest. Digoxin is prescribed for the heart failure. We know the drug of choice for the pregnancy heart failure is diuretics because they will reduce the preload. We can also use hydralazine or ACE inhibitors because they are going to do decrease the afterload. ACE inhibitors, we have talked that it is used to be only used after postpartum, after delivery only. So ACE inhibitors, they are not generally contraindicated, they are only contraindicated before the birth of baby. Then beta blockers can be used, and again anticoagulants are used. Why anticoagulants are used? Because thromboembolism is one of the cause of mortality, so anticoagulant therapy is used. Now they can ask you what will be the preferred mode of delivery. So preferred mode of delivery will be vaginal delivery, so go for the normal vaginal delivery, NVD. Then they can ask you that if you have to provide the anesthesia, what is the preferred anesthesia or the ideal anesthesia in case of peripartum cardiomyopathy? So it is the epidural anesthesia. They can ask you that after the birth of baby, is the breastfeeding allowed or it is contraindicated? So breastfeeding is allowed or contraindicated? No contraindication. You can allow the breastfeeding, so there is no contraindication. Then they can ask you what is the prognosis, what is the mortality. So mortality is high, so the patient can die. So high, it's about 20 to 50%. And what is the reason for the mortality? Was the congestive cardiac failure. Second is that arrhythmia, because of arrhythmia patient can die, or thromboembolism, and that's why we were using the anticoagulation, thromboembolism. Then the patient can ask you that, doctor, can it reoccur in subsequent pregnancies? So yes, it can recur in subsequent pregnancies. So this is all about the peripartum cardiomyopathy.